Hi, thank you guys for having me today, and I'm excited to tell you about some innovation in healthcare, something that really affects all of us. So I'd like to start out talking about diabetes, and really that's going to be the focus that we're going to talk about. And the face of diabetes is really the face of you and me as a child and a teenager. They don't look sick, they're regular kids. But they face really serious consequences in their 20s and 30s if they don't take their insulin. So we're going to use me as a hypothetical patient, which I don't have diabetes, but I'm going to protect my patient's privacy HIPAA laws by using myself as a hypothetical patient. And I'm going to tell you about two different life paths in your 20s and 30s that can occur whether you take your insulin or not as a teen. So here we have on the left a young woman in her 30s enjoying a trip to Paris with her husband, seeing the sights. But she took her insulin. On the right is a patient, the same young woman that if she didn't take her insulin in her teens would be using a walking stick and wouldn't be seeing any sights. On the left, we have the woman that took her insulin with diabetes and is enjoying a walk down the Champs-Elysees. But then on the right, we have a woman that didn't take her insulin in her 20s and 30s that is actually learning to walk again because of an amputation or because of a stroke. The woman on the left would be enjoying the sights and fashion and Christian Louboutin heels of Paris, while the woman on the right would be worrying about heel ulcers, as well as possible infections that could lead to amputation because she wasn't taking her insulin. The woman on the left would achieve her dream of being a doctor in her 20s, but the woman on the right would not be able to concentrate in class, and she wouldn't be able to concentrate in work because of the inability of her body to have insulin, so she would be applying for disability insurance in her 20s. 23.6 million people have diabetes in the United States, and 190,000 of them are children under the age of 20. So obviously, we've been talking about the importance of insulin in your young age. And I'll tell you that diabetes is a problem with insulin. It's divided up by whether or not your insulin is being attacked in the pancreas, which is type 1 diabetes or juvenile diabetes. It's also divided up whether the insulin key is working in the cell, and when it's not working, that's called type 2 diabetes. Insulin is important because it is like a key that opens up the door so that glucose can get inside of the cell, and the cell can make lots of energy and do the functions that it's supposed to do. And what happens if you don't have insulin is diabetes. The cells are essentially starving. And the problem with having the blood sugar in the bloodstream is what causes all of the damage with diabetes. The way that we give insulin is that every time that you eat something, you get a bolus insulin. And when you're not eating, you get a basal amount of insulin because our bodies and our cells still need the insulin. It's an exciting time that here with technology, we actually have insulin pumps that can supply the insulin, so all you have to do is press a button every time that you eat. And in fact, this is where the insulin goes, and every 3 days you change this site into the stomach. And it's subcutaneous, it's not a surgery inside of the stomach. This is a continuous glucose monitor that beams information over to the insulin pump, along with the glucose meter that beams information over to the insulin pump. And this is how we currently manage diabetes, with an excellent data interface so that we can have all of the information, in which everybody in this room knows that information is power. The future of diabetes is exciting. Actually, this right here is a sensor that's being developed, where you can check your blood sugars. It's not super accurate right now, but it will go over to the console right here, and it'll tell the GPS where you can stop if you're having a low blood sugar. So it'll tell you the closest gas station. And also right here is the nano pump, which is kind of like a computer chip that can be implanted inside of, kind of like your dog's computer chip, implanted inside of your pancreas. And what it does is it allows cells inside that make the insulin so that it can make the insulin, but it blocks all the antibodies that your body is producing and fighting those cells. So it's actually a potential cure and very exciting. But what do we do about the patient, the hypothetical patient, the young girl that we just talked about, who's starting out her life? These are future ideas. What do we do right now? And I would say that we need to give her support and encouragement to take her insulin. And I would say that it's important for us to meet her where she is right now. And teens right now are texting. In my office, I see teens texting all the time. So texting is not a new idea with the evolution of healthcare innovation ideas, but it's innovative that I just did it. And apparently, I'm one of the first people that actually just did it. So what I did was I picked 3 patients, and I gave them an introductory message. Hello, this is Dr. Dyer. How are you doing today? Every Thursday at 5 o'clock for 3 months. The next message I would give them would be something personal and supportive, because I'm not a cop. I actually care about what they care about. And that personal aspect is critical for helping with something like diabetes that's so intrusive to your life, to every meal, to every hour of your life. They need support. And then the next messages would all be medical. So it would be, according to the insulin, are you doing your boluses? Are you doing good with your blood sugars? And because I thought that it really was going to work, I actually would ask, are you having high blood sugars? Are you having low blood sugars? And then I'd give them a concluding, inspiring conclusion remark like, keep up the good work. I know it's hard, but you're doing a good job. So really what happened was that everybody's hemoglobin A1C or their diabetes report card improved over 3 months from a D- to a B+. And that was really inspiring. Everybody was very happy. Their doctor was really happy. The patients were really happy. And their parents were really happy. So although I have about 500 or 600 patients, I actually can't personally text them every Thursday at 5 o'clock. So I had to develop a new innovation that would allow me to have an automated yet personal attachment through texting with my patients. Like I mentioned, I think it's critical about the personalized aspect. So what this iPhone application would do would allow me to enter personal information about my patient, like, are you excited about that new blue prom dress that you just bought? How about those new shoes, and how is motocross sports going? So these are the aspects that I actually know quite a bit about my patients. But they would be automated into statements with the texting element. The iPhone only has to be the provider's iPhone. So other providers, other healthcare providers who have an iPhone could have an iPhone app that would send out automated messages for texting. So the patients only have to have, basically, they only have to have texting ability with their phones. And the baseline data would be entered into the provider's phone, just like you enter your contacts. So the data would also be stored outside of my phone because privacy is an issue. And what if I lost my phone on the airplane and all of my patient's information is on there? The patient phone only has to receive and send texts, so it doesn't have to be a smartphone. And the way that this innovation started is that I'm on Twitter. I'm Endo Goddess. I talked about some non-randomized, non-scientific trial data because it's a pilot study. And a medical student who went back to school, he used to be a programmer, went back to school to do some global health work that he's looking forward to doing. He said, well, I'm a second-year med student. I have a penchant for coding. I'd love to help you automate that. So we got together, and we developed, through using some simple online resources and only 2 cents a text for storing and receiving the text, so that there's an external database that holds all the information, we programmed an iPhone app. So I'm going to show you a little bit about how it works. We're going to use a sample patient, Nick Jonas. He has type 1 diabetes. So what we're going to do is we're going to add the patient easily. The provider adds it onto the iPhone. So you enter in Nick Jonas, and you put the different social cues or personal aspects about he's in music, he likes frappuccinos, So then once we finish entering all the different information, then we'll get a signal that goes out to Nick that says, hey, Nick, I've added you to my database. And he says, cool, keep rocking, Dr. Dyer. So the messages will look like this. They'll be stored here. This is what I said, and this is what he said back. And then these are all the queued up messages ready to go. So whenever I'm ready to send out the queued up messages to however many patients I want to send them out to, this is how easy it is. I just press send queued messages. So what will happen is that Nick Jonas will be in his life on Thursday at 5 o'clock, and a message will come out. Glad to have you as a patient advocate, Nick. Next week, he's pumping gas on Thursday at 5 o'clock. Hope the work on the new album's going well. Then he's getting a Frappuccino. I say, hope the carb counting goes well. Then he's also moving about with his tour, and then I say, hope you're not having any trouble remembering boluses. And he's still on tour, and I say, keep rocking the boluses, Nick, because diabetes never quits. And as you guys know, this is at the TweetDeck interface, and this is a good way of monitoring multiple conversations. So actually right now we're building it onto my iPhone application that I, on my phone, can monitor all these conversations going on. So the bottom line, so what's next? Well, we hope that lots of patients' diabetes report cards will be improved, and that lots of young women will be enjoying a trip to Paris versus the other alternative. But there still are challenges that remain. Challenges that include privacy concerns, as well as physician shortage concerns. And in addition, the fact that a lot of physicians are not going to be doing this unless that they can get reimbursement. That's a big hindering block. And these are all systematic changes that have to occur. But I'd like to say that as far as these concerns, I think that an M-Health movement is upon us. This is using mobile phones and thinking outside of the box and thinking about what's right for patients, because it's the right thing to do whenever you meet a patient where they are. And it's more about health caring and health sharing. And really, I think that it comes down to a simple idea of that healthcare, good healthcare, is meeting people where they are and helping people out. And I'd like to conclude with that. Thanks.